Hello. You know, as a pelvic health physiotherapist, I talk with women every single day who are navigating this world of persistent and, frankly, really confusing pelvic pain. If that's you, I want you to hear this. What you're feeling is real, it has a name, and there is absolutely a clear path to getting relief. So today, let's walk through that path together. Does this sound familiar? That deep, dull ache that you just can't quite put your finger on? Maybe you feel it in your rectum or just deep inside your pelvis. It's this nagging discomfort that just won't go away. And I know it can be incredibly disruptive and so distressing. So right off the bat, I want to tell you, you are so not alone in this. And this pain, it is not in your head. There is a real physical reason for what you're feeling. And understanding that reason is truly the first step toward feeling better. Okay, so let's dive in a little deeper, because to find the right solution, we've got to get really clear on the problem first. Let's take a look at the common ways this specific kind of pain tends to show up. So many of the women I see describe it as a dull ache that gets way worse when they sit for long periods of time, or even when they lie down, which of course can completely disrupt sleep. It can feel like this constant pressure, almost like you're sitting on a ball. Sometimes it comes with low back pain that can even travel down into the groin or thighs. And for many, it also causes pain with intercourse. If you're sitting there nodding along to any of this, you're in exactly the right place. You see, this collection of symptoms isn't just random. It's a classic pattern that points directly to a treatable condition. Just giving it a name and understanding what's going on inside your body is incredibly empowering. It moves you out of that feeling of uncertainty and into a place of action. So let's give it that name. What we're talking about is a condition called Levator Ani Syndrome. But what does that actually mean? What's happening inside your body? To put it simply, Levator Ani Syndrome is all about muscle tension. Your pelvic floor muscles, which are so critical for support and function, have become overactive. They've forgotten how to relax properly. They're basically stuck in this state of being constantly switched on, and that leads directly to chronic pain. A really great way to picture this is to think of your pelvic floor as a muscular hammock that holds up your pelvic organs. Now, in a healthy pelvic floor, this hammock is supportive, but it's also flexible. With Levator Ani Syndrome, though, that hammock is pulled constantly, unyieldingly tight. And this is a really crucial point. Pelvic floor dysfunction isn't just one thing. It can go in two different directions. Some people have what we call hypotonic, or overly loose muscles, which can cause issues like incontinence. But Levator Ani Syndrome is the exact opposite. It's caused by hypertonic, overly tight muscles. So the problem here is too much tension, not weakness. So how does all this muscle tightness cause the other symptoms you might be dealing with? Because let's be honest, it's rarely just about the pain, is it? Well, that super tight muscular hammock affects everything it's connected to. When it comes to your bowels, it can lead to constipation or that really frustrating feeling of not being able to empty completely. For your bladder, it might cause urgency, frequency, or even pain. And like we've mentioned, it's a very common reason for painful intercourse. All of these different issues stem from that same root cause, overactive muscles. So why does this even happen? Well, the causes can be really varied. It might be related to an old injury, a surgery, or other chronic pain conditions like endometriosis or IBS. Sometimes even habits like constantly holding your pee or delaying bowel movements can contribute over time. The most important thing to know is that it's not your fault. It's just a physiological response your body has learned. All right, now let's get to the good part, getting relief. This is where, unfortunately, so many women get led down the wrong path by well-meaning but totally incorrect advice that's all over the internet. I honestly cannot stress this enough. If you take away only one thing from our little chat today, please let it be this. Kegels are not always the answer. For this condition in particular, they can make things so much worse. Let me break down why. We've just established that Levator Ani Syndrome is a problem of tightness. A Kegel, by its very definition, is a muscle contraction. Asking a muscle that is already way too tight and probably in spasm to contract even more, well, it's like yanking on a knot to try and untie it. It just makes the tension and the pain worse. The very first step to healing is teaching these muscles how to let go. And this is exactly why a one-size-fits-all approach just doesn't work for pelvic health. True, lasting recovery always begins with a thorough, personalized assessment from a trained professional who can figure out what your body actually needs. So what does the right approach look like? Well, it involves specialized pelvic floor physiotherapy.
And I want to emphasize that this is a gentle, evidence-based, and highly effective treatment for Levator Ani Syndrome.
Your path to recovery would start with a really thorough, gentle assessment. From there, we focus on what your body is crying out for, learning how to release that tension using relaxation techniques and proper breathing. We use gentle, hands-on manual therapy to help the muscles let go, and tools like biofeedback to help you reconnect your brain to your pelvic floor. The goal isn't just a quick fix, it's to empower you with strategies for long-term health.
And I want to be clear, this isn't just a hopeful idea, it's a clinical fact. Pelvic floor physiotherapy is considered a primary, cornerstone treatment for this condition. It's truly about restoring balance and function to your body in the most effective way we know how.
At OVA Women's Health, this is exactly what we do. It's our expertise. We're not general physiotherapists. We are specialists with advanced international training, specifically in treating complex pelvic pain conditions like Levator Ani Syndrome. We get how absolutely exhausting this can be, and our approach is always compassionate, grounded in evidence, and tailored completely to you. So, I'll just ask you this. Are you ready to finally understand the why behind your pain? Are you ready to move past all that uncertainty and start on a path toward a life with less pain and more control? I want you to know that relief really is possible. If you're ready to take that first step, we're here and we're ready to help. You can just scan the code on your screen to book a confidential consultation. Please don't keep putting it off. The sooner we can start, the sooner you can begin that journey back to feeling comfortable and strong in your own body again.